Circle.
Hey guys,
Hey everybody.
this is Jamie and Christine with
Mhm.
Iowa Diabetes. It's September, the weather's
Mhm.
getting nicer.
So nice.
And we're here to talk with you guys about a very important topic, diabetes and high cholesterol, and really break it down on how the two intermingle and
Right.
really work together on by controlling both, preventing complications.
Exactly. Like, why should you even care about your cholesterol, right?
Exactly. Why do I care? Why are you putting me on extra medicines? We're going to try to explain all of that today. But the first thing that we've got is that we've got over 37 million Americans that have diabetes, also have high cholesterol.
And that's a huge number,
It's a
right?
huge number. So, huge number of Americans that are affected, and it's something that we do want to pay close attention to as we're taking care of you. So, dry topic, we're going to try to make it fun. We're going to try to make it engaging. First thing that I want to know, with the cooler weather, what have you guys done outside to kind of get out there and enjoy it? How about you?
Well, I took my kids apple picking on Sunday, which was super fun. And then, based on this cholesterol talk, actually, we went home. My daughter and I made some low cholesterol apple crisp muffins.
That sounds delicious.
And they were actually really good. Yeah, we used Greek yogurt and applesauce instead of the oils. It actually turned out delicious.
I haven't done it yet because we've been so busy with like family events and things, but I do want to do the pumpkin patch.
Oh yeah, definitely.
I definitely want to do that coming up here really soon. So let's get started. Let's really try to talk. Why should you care about high cholesterol and diabetes?
Well, one of the things, and I'm going to show a little diagram. How about we do that?
Yep.
Let's make this interactive today, okay? All right. So let's say that this is a blood vessel. When you have high blood sugars, that actually makes the lining of these blood vessels more sticky. And then when you have high cholesterol and high triglycerides, those extra fats and cholesterol can actually get stuck to the lining of the blood vessel. And so let's just say we have some, and that actually is, there's a name for that, it's called atherosclerosis, okay? Well, what's that going to do? One, it's going to narrow the blood vessel. So blood's not going to be able to flow as well through there. But what can happen here, and let's say this is one of your bigger vessels, but what if you have a smaller vessel that has that problem as well? You know, some of those smaller vessels to the feet. You know, we hear a lot of our patients say you're having foot pain, you're having neuropathy. This can be a big cause with that. And then if some of these plaques break off into some of those smaller vessels, now you can occlude that whole vessel. And that's what can lead to something, you know, like a heart attack or a stroke. So diabetes, having those extra sugars, the body actually converts those to triglycerides, to lipids, to extra fats. So the body has to do something with those sugars, and now they're floating around the bloodstream. And then that's where they can get stuck and really cause that occlusion to those blood vessels.
So when we get our cholesterol checked, we get 4 numbers, right?
Mhm.
So we get total cholesterol,
Yep.
LDL, HDL, and triglycerides, which we often call TG.
Mhm.
It's alphabet soup, but we also wanted to spend a little bit of time to explain what those actual numbers mean and what they're doing in the actual blood vessels and in the body, because they're all very important.
Right.
So total cholesterol, I don't pay very much attention to it. It's just everything together.
Right.
I'm more worried about the individual components because
Completely
those
agree.
little guys have different roles.
Right.
So we have the LDL, or our lousy cholesterol.
Yep, I love that. That's a great way of explaining it.
Also, you may hear it called the bad cholesterol. So what's this bad cholesterol doing in the body?
Well, and that's the cholesterol that I kind of showed here. That's the one that is going to be more known to clog those arteries and lead to those secondary complications.
Mm-hmm. And then we have our healthy cholesterol, our good cholesterol. It's called our HDL.
Yep.
And these guys, we want a little bit of higher.
We do.
What are these guys doing?
So we were talking about this. I use the analogy. These are like the policemen that are going around the bloodstream, and they are getting those bad cholesterols out of the body. So if we don't have
They are a little eraser.
Yeah, they're like, get out of there. Let's get you out of there. You guys are bad cholesterol. We don't want you here. And if you don't have enough police guys going around, then you have some of those bad cholesterol is going to start wreaking havoc.
Yep.
Right. So, and we're going to talk about some ways to get that HDL cholesterol increased, because it is important to have that at a good number.
Yeah, and unfortunately with diabetes, our HDL, our healthy cholesterol, tends to be a little bit
It really
lower.
does. Yeah.
And our LDL, or our bad one, tends to be a little bit on the higher side. The last component that we do talk about is the triglycerides. And those are going to be our fats that are kind of floating
Yeah.
around in our bloodstream. So they're really affected by your most recent meals.
Right.
If you're eating clean, you tend to have lower ones. If you
Mhm.
have lower sugars, they'll be lower.
Right.
But if you happen to go to McDonald's the day before or right before coming to the appointment, we're going to see that fat floating around in your
Yeah.
blood.
And the body has to do something with those extra sugars, right? And so the liver does convert those extra sugars a lot of times to those fats.
Yep.
And what can happen with that is some of those fats don't leave the liver. They get stuck there. And that's where you hear the term of fatty liver. And what can happen is those fat cells can cause some irritation, some inflammation around themselves. And then that causes kind of like a scar tissue.
Yep.
That's known as your fibrosis. And so fibrosis, the liver is just not quite moving like it should, functioning like it should. And in time, if that continues, that can actually lead to cirrhosis of the liver, which we definitely don't want.
And those two complications before, I don't know, 5, 10, 15 years ago, yeah, we thought they were kind of connected, but truly diabetes and fatty liver
Yeah.
are very interconnected. And it's just because of how the body processes all those extra, maybe unneeded nutrients that
Right.
we're getting. So I think you broke it down great. We're doing studies on fatty liver.
We are.
We've got some really cool options of what we're looking at. So if you guys are interested in getting either a free scan
Yep.
to see if you want, to see if you have fatty liver,
Right.
nobody wants it, but see if you have
Right.
fatty liver, or if you're interested in seeing if you qualify it because you already know that you have fatty liver, give us a call. We'd be happy to talk with you to do either of those.
Yeah,
two
and it's a
things.
simple ultrasound. There's no pain. It takes a few minutes. So it's a real simple test to see if you have fatty liver and if you have fibrosis.
If you do want to see, I think we have a quick 2-minute video on our site, both on the diabetes site and on YouTube, on Dr. B getting his fatty liver scan.
Yeah.
So we do have a 2-minute video on what happens.
So what other complications can we see then? We know that the blood vessels are narrowing. So what does that equivalent into?
Yeah, that's going to lead to our heart attacks and our strokes. So, and a heart attack is when that artery clogs and the muscle tissue, so the heart tissue, is not getting any oxygen, and you get tissue death. With heart attacks and strokes, time is money. So time
Yeah.
is tissue. So the longer you're having that pain or some of those symptoms, the more of the tissue, either in the heart or in the brain, that is kind of dying or having problems getting enough oxygen.
I actually had a patient that I treated in the emergency department that had this problem and actually had a blood clot in the renal artery, so going to the kidney, and lost function of that kidney because of it. So there, it's not just the heart, it's not just the brain, but everywhere in the body, there's these vessels. So the eyes, people don't even think even the ears can be affected by this. It's really crazy, all the systems in the body that can be affected if that cholesterol is high,
too high.
and then the diabetes are out of control.
So we've talked kind of Debbie Downers, right? Oh, all
What
these
do we do
complications. All these complications. So what can we do? There are steps that you can take. One, controlling the sugars will help make these blood vessels less sticky. It's not going to clear out the cholesterol. So there's other things that we can do with the cholesterol side as well. So what are some of the things that you talk about mostly for diet?
Well, I'm going to have this little fish swim by here because one of the things that we talk about that's actually been shown with cholesterol and has been with fatty liver is the Mediterranean diet.
Yeah, I hear that a lot, and I associate it like healthy eating, but it's not just healthy eating. What exactly is the Mediterranean diet?
So it's a combination of a lot of different things. One is your healthy proteins. So your fish that have some of those healthy omegas that are going to help to increase that HDL cholesterol, your lean chicken, your lean meat. A lot of non-starchy vegetables,
Yes.
incorporating a variety of those, that's going to have fiber in there. It's going to have the nutrients our body needs. We know that fiber in general actually helps to reduce the absorption of cholesterol from our food.
Yes.
So looking at those healthy fats and avoiding the saturated fats that we know increase cholesterol. And then the whole grains, less processed, less sugar, more whole grains, whole grain rice, quinoa, a variety of that in combination, then some of your healthy fruits.
Healthy fruits, healthy fats. So
Right.
we're talking about, like we said, those very clean, healthy, lean proteins. Fishes at least twice a week, I think, is the recommendation on that one. And you want your healthy fishes that are higher in those omega-3s. I think of salmon.
Yep, me too.
There's others out there, so don't feel like you have to have salmon
Right.
every day of the week. But there are that is a great option. Besides this fish and the meats, just like you said, it's our healthy fats and vegetables. So avocados,
Yep, that's a good one.
olives, and olive oil.
Yeah.
And then it's our clean, fresh fruits and vegetables. If you think about how the Mediterranean diet is, and you think of those small little tapas plates that they create, right? It's all of those fresh fruits, those fresh vegetables combined in different ways.
Right, exactly. Even I had a patient the other day, we're talking about cholesterol and increasing fiber and increasing that HDL cholesterol. And she's doing some Greek yogurt. I'm like, you know what? You can add some flaxseed, ground flaxseed. Your body can't digest the seeds whole, but the ground flaxseed, and that is one way. It's a healthy fat, a way to increase that HDL cholesterol and get some of the fiber in the diet. And it's a simple thing, right? Add a scoop to your yogurt.
Yeah, why not?
It doesn't have to be a crazy lifestyle modification. Really just try and incorporate even increase your veggies a couple each day.
Yep.
I'm going to add a new vegetable for lunch. I'm going to add a couple of new things for dinner and slowly incorporate that into your routine. And it's going to make it a lot easier to change those habits.
It really is. It's the simple changes. And so don't feel like you have to overhaul everything. It's just choose one of those things to do, like using apples and applesauce in your baking versus eggs and oil. Absolutely a way to make a small change, but that small change has a big impact.
Right. One thing I've talked to you about before in my patients and in here even is doing a cold glass of fiber water before a meal. And that's like a Benefiber, a Metamucil. And that cold glass, an 8 ounce can do a few things. One, it increases your metabolism for at least an hour.
Yes.
The fiber slows down the absorption of those sugars, so you don't get as much of a big spike. It makes you feel fuller sooner. So that can help with portion control, making good choices. It's food for our gut critters, which we know are beneficial as well. But that fiber actually reduces the absorption of the cholesterol from our food as well. So lots of benefits just by doing one little change before your meal.
And this, I'll just tell you, this is how like some of those cereal brands out there get good for cholesterol on them because they're higher in fiber.
Yeah.
Don't necessarily go out and buy them. Still look at the carb content on them.
The sugar.
Look at the sugar, but they get that heart healthy benefit because of that fiber in it. So huge benefits, very, very well documented in benefits out of these.
Now you have your Movement Mondays going on.
Oh, yes.
Can that help with the cholesterol as well?
Absolutely. Actually, there are no medicines on the market that increase your HDL significantly. There are 0 medicines that can do this. There are a couple of recommendations that I have. The easiest one is exercise. Exercise, and in particular, cardiovascular exercise. So the walking, the running, the biking is going to increase your HDL, your healthy stuff. Exercise will clear your system out and cleanse you. The other one that you can do is a moderate amount of red wine. Moderate. Don't go out and drink your bottle. I told Christine we needed some red wine here for our talk. But those 2 things absolutely can help improve your HDL.
I also like the resistance exercises because we know that muscle uses sugar as its fuel. And so if you can increase that muscle mass, you're going to naturally lower those blood sugars. You're actually going to increase your baseline metabolism, which helps with weight management as well. So that is another thing. Even just adding like 10 to 15 minutes of even just a band exercise a day while you're watching your favorite show really can have a positive impact on your blood sugars and your cholesterol.
if you're a patient of ours, we give out a card, and I recommend to do that top row one day, and the next time you do the middle row, and then the next time you do the bottom row. That way you get a kind of a structured workout every time. If you're not one of our patients, we have used Jen Wagner on here, but she's developed 5-minute videos. I use those 5-minute videos in my education class. I do them along with the patients I'm teaching. I get tired during those 5-minute videos of resistance bands. So go check them out. They're free on her YouTube channel. If you don't know how to get started in some of this, that's a great place to get started. Other ways, the other way to lower cholesterol, we've got medications. The one that we use oftentimes is going to be our statin class. So rosuvastatin, atorvastatin, simvastatin. We call them the statins because they all end that way. In addition to lowering our LDL or our lousy cholesterol, these do other things. They make these little plaques harder to rupture. So if these rupture, they go off there and cause that clot. They make that more stable. So in addition to lowering that cholesterol, they're preventing heart attacks and strokes. So most likely we're going to put you on one if your risk for heart disease is high enough. So once you have diabetes, we're starting to evaluate that risk for heart disease. And that's one that often gets added. The side effects of them are significant. With it, you'll get muscle aches. It's not just a one day my muscle hurts. You're going to feel like you've worked out in your major muscles, like your arms, your legs, without actually doing that workout. If you get that type of a symptom, do call your doctor, call your pharmacist. They'll help you work through the process of if you should stop that medicine or not. Here, what we'll do is I usually recommend stopping the medicine for a few days, see if that symptom in the muscles or the legs goes away, and then we may retrial it back if it wasn't severe. If it comes back, then we know it's that statin.
Right.
So we do kind of a little on-off to see if it actually was the cause or not.
Right. But at least there are other ways to help lower that, bad cholesterol. And it is important to incorporate those as well, because sometimes medications aren't for everyone, like you mentioned.
Yep.
So there's some other ways out there, you guys. You can do it.
And starting early, as soon as you're knowing and understanding that you have maybe higher cholesterol or even just got diagnosed with diabetes, if you start these things now, it prevents the cholesterol from getting even higher and getting out of control. Exactly. So starting early is definitely key.
And if you have any other questions that we haven't answered here today, please feel free to comment below. Even after the video is done, we go back and read those. So we'd love to answer your questions.
And we've got a question from Noreen. So Noreen, I'm going to flash this up. We've got a question. Like, what if you're allergic to statins and diabetic drugs? Having very, very bad muscle aches and pains with them. And that's where statins aren't for everybody.
Right.
There are other drugs that you can try. They're a little bit more expensive than our statins. Statins are just a pill, but there are some injections that you can take that have been proven to prevent heart attack and stroke in those with very high risk for heart attacks and strokes. There are PCSK9s. I know. Alphabet soup there. Praluent is the brand name of one of them. And so I think they are out there. They're injections either every 2 weeks or every 4 weeks that can be done. Repatha is another one that can be done for the cholesterol as well. So they work very, very well. It's just kind of a trial until you can get on one of those if you need the medicine assistance. If you can't do the medicine assistance, you've got to double down on that Mediterranean diet, double down on that fiber, and really work on that exercise.
And that fiber can be before multiple meals throughout the day. So that in itself could, reduce the absorption of that cholesterol, breakfast, lunch, and dinner if your body can tolerate that. So that is definitely an option also.
Yeah. Good questions. Thank you. we'll kind of stick around a couple of more minutes. We've got some good plans. This is our last one for September, but we've got some good plans for what's coming up in our spooky October.
Oh yes. We don't want people getting spooked, right?
Right? We're going to avoid some things. We're going to help you avoid some spooky things in October. And I may convince Christine to wear a costume.
Well, if you're like my daughter, she wants me to be Elsa. So
I would
don't know how
too.
spooky that is.
And Mercy, it looks like you have a question. My sugar level is 8.7. What can I do?
Okay.
So with your A1C being 8.7, most patients we want less than 7%.
Right.
So Christine, we get these in our clinic all the time.
All the time.
What are we telling patients?
And we're telling what we're telling you guys here today. My initial 2 lifestyle modifications are to add that fiber water and to start those resistance exercises. Even after a week, your muscles do notice a difference of adding that muscle. That's the first thing. Then coming up with a medication regimen that's going to be right for you. And I don't know what you're taking right now, but there's a bunch of different classes. What are weight management goals? We look at the whole picture to decide what is the best option that's going to be doable, that's going to be cost effective, and that's really going to lower that A1C in an effective way. That's not going to make you feel like you're just all the time stressed out about your diabetes.
Yeah.
We want it to be manageable. We want you to enjoy life, but we want to give you those tools so that you can do so and not have those spooky complications, which we'll talk about next time.
And you hinted at it, you talked about it, but there is no one right way to treat diabetes.
There really isn't.
There is your way, and you've got to work with the provider that's going to have that discussion with you to get the right combination of how much exercise are you able to do.
Yeah.
How much diet changes are you motivated and willing to do? And then we use that medicine to kind of help where the other ones aren't able to do.
I love having my patients bring me in a food journal because then I look and I say, oh, you could swap. This is a real easy swap, or here's a real easy way to add in some extra nutrients to your meal. And then each time I see them, we incorporate those little swaps and it's very doable. It's not a major lifestyle change, but little things here and there long-term can make a big, big difference in your diabetes and just overall health.
Good luck. I know you're on a long journey. Good luck. Good luck. Call us if you have any other questions, any other advice that you are wanting. We are more than willing to talk with you about what we've got for clinic here. Phone number 515.
I'm glad you know
650-9222.
I have to look it up every time. I'm not going to lie.
I have it on a Post-it note in my office. Otherwise, we're going to sign off for today, and we will see you guys in October.
Bye, everybody. Have a great day.